This is The Fix.
My name is Carol Self, and I'm with Casey Family Programs. I'm a Director of Public Policy. Casey Family Programs is one of the nation's largest operating foundations that's solely dedicated to ending the need and eliminating the need for foster care. We work with all 50 states, working directly with state agencies, as well as doing public policy work, which is what I get to do. Prior to coming to Casey, I actually worked for DFPS. So I spent my career, I retired in 2021. I was the Director of Permanency, so I was responsible for the policies and practices as it relates to our kids in conservatorship. So community-based care is basically shifting from a kind of one-size-fits-all state-administered child welfare system to a much more flexible community-based approach. The idea being that instead of the state agency being responsible for the delivery of services to children and families, and being directed in Austin at the state. I mean, my old job was to figure out what the policies were going to be for how everybody in the state would operate. Community-based care allows for some flexibility for a provider to be able to, in a community, to be able to look at, okay, what are the needs of our community? What do we want to do? Maybe there's some promising practices or best practices out there that we as a community want to do so that we can serve children and families. And it doesn't have to look like what I do in Dallas doesn't have to look necessarily like what I'm doing in Houston. And so it also allows for, I think, the communities to be more nimble and to respond in a more nimble fashion. It's started out as foster care redesign. It's kind of morphed over the years, and it was back in, I think, 2007 that the agency first started collaborating with the stakeholders around shifting to kind of outsourcing, is kind of what we called it, which was basically outsourcing just the service, like placement of children and services to families. And then over the years, and with guidance from the Texas legislature, it's moved and transformed into what we now call community-based care. Stage one is where the contractor takes on the SSCC, or the single source continuum contractor, takes on the placement services. So the agency still has the conservatorship workers, they're still doing case management, but when there's a removal, the contractor takes over finding placement for the child and managing that placement, but then you still have a conservatorship worker. And at stage two is when you transition to where the case management services go over to the contractor. So it's during that point at which that the like your former conservatorship worker that worked for CPS potentially and hopefully will go and work for the provider, and all those services move to the provider. So the agency no longer has conservatorship caseworkers, that's all with the provider. And then there's a stage three, that at the point at which they've kind of worked out all the bumps and bruises of taking on all the services, that they'll move to stage three, which is really where they get into the performance contracting piece of managing and really looking at all services being done by the provider. Texas is one of the first ones that's really been able to benefit from the lessons learned from Florida and Kansas, and really did a deep dive into kind of recognizing, okay, if you are transitioning, what are the things that you need to do? So looking at the implementation, slowly shifting, not going all at once. When Kansas did it, it was flip the switch. They went from one day being state ran to 100% privatized. I know in Texas, a lot of the conversations that we had was, we've been doing it the way Texas has done it for, forever. And maybe there is a better way of doing it, and sometimes you have to, put your egos aside and say, okay, you know what, if somebody else can do it better, we want what's best for our children and families. So whatever that looks like, and we have to be open to saying, okay, maybe there's a better way. Through partnering with some different consultants and universities, and hearing from the communities about what made sense for the catchment areas. So Texas was divided into the 12 regions. And when you're dealing with community, you want to keep it community, but sometimes the communities don't make sense. You know, you have some really large regions like Region 6, which is Houston and all the, now they're 6A and 6B, but you have some really large areas. So it's like, how can you scale it down and find areas where you truly do have that community level and that community base? Change is hard. You know, I think that more than anything is just, and the unknown is even scarier, you know, because it's, you don't know. I mean, we know what we know, and we know how we've always done things. And sometimes it's scary to let go of, you know, and saying, okay, we're going to trust this provider to come and do all the things. And so there's bumps and bruises that go with that. You know, your providers who are taking on this huge task of, you know, absorbing the services for the children and families in their community, you know, the state is the state, and we have all these resources, and we're really big. And, you know, and sometimes I think there was expectations that when the providers took on, I mean, they would from day one be doing the exact same thing. And it's like, no, you have to give them some, you know, it's new to them too. And so I think that there's some growing pains that come from that. It's helpful for folks to take a step back and say, okay, we have to approach this with some grace and say, okay, we want this to be successful. We want their support. We want to support them as stakeholders in the community. We want them, if we want what's best for our children and families, then we want them to be successful. It's all about, we're all Texans, these are all Texas children, these are all Texas families. How do we make sure that we're doing right by all of them? So.